Hello everyone, once again welcome to my Oet channel. Today we will see one role play. This is a recent exam question in which you are talking to a parent of 4 years old boy. He has complaints of ear pain and some hearing disability. I mean not disability, hearing problems related to this pain. So it's suspected to have some infection inside the ear. And the baby is nearby, playing nearby, and you are in the community health center and you are talking to the mother or father, so whatever. In this role play you have to think one thing, important thing, because you are talking to parent, not to the patient. So this is known as second degree talk. In this talk you have to be cautious, because whenever you will give the advice, mostly at a time of suggestions, you will make mistake. You will tell that it is important for you to do like that, so or please do, or please try to avoid something like that. If you are talking, the patient should be the son, not the mother or father. So you have to talk in such way. It is important for him. So this is a boy. You can tell it is important for him to avoid, or please try to avoid for him. So something like that. It should be that that sentence construction should be in the second degree talk. So we will see what all the task involves in that role play and how we have to present the role play. So just we will have a look on that. So first I will read for you the case note, and here actually this is a general practice. You see the worried parent of a 4-year-old boy. He has been complaining of a painful left ear and also seems to have difficulty hearing. So the parent has come for advice. His or her son is busy playing nearby. From what he or she says, you suspect otitis media and ear infection and advise the need for a GP appointment. So this is the scenario of this role play, and we can see how we can start. The first task is find out the reason for patient's visit. So until now you didn't inspect patient's ear. So we can just start like in normal way. Good morning, my name is Rashmi Rajan, one of the registered nurses working in this general practice. How may I address you and how can I help you today? Then, mother is telling that my name is Maria and I came here for my 4-year-old boy who has been complaining of a painful left ear. And it seems very difficult, it seems to have difficult hearing also. And I'm so much anxious, sister, regarding my boy's condition. Then, here, after getting the patient's, parents' concern, you have to sympathize there. So you can just inform that, well, Maria, I'm so sorry to know about your baby's condition, but no need to worry. I am here to help you. Before proceeding further, may I ask you some questions regarding your baby's condition? So that is just like additional talk. Then the second task is find out more details about child symptom like severity, treatments tried. So how we can ask, Mary, could you please tell me from when this problem has started and what is the severity of your baby's problem? Then mother may inform you the problem has started a couple of days ago and he cries a lot and sometimes he has trouble sleeping even night time. He used to cry, and actually the severity, I mean, it is like he has severe pain, that's why continuously he's crying. Then we can tell that, okay, Maria, on one more point I would like to ask you, have you tried any remedies at home? Then mother may tell that actually I have not given anything for it as I'm not sure about what to give. Then we can tell that, Maria, no need to worry, we can help, we are here to help your babies, no need to worry about your baby's problem. Then our next task is give likely reason for symptoms like otitis media, ear infection. It can be acute or chronic, often treated with antibiotics. Then advise need for GP's appointment to confirm the diagnosis and prescribe antibiotics. So we can present in such way. Maria, from your conversation, what I can understand that it seems to be otitis media. Medically, we will call like this. It is nothing but ear infection, and it can be acute or chronic. But it's like we can easily treat it with antibiotics. We had many patients here with the same problem, and we had treated with the proper antibiotics. So that I am strongly suggesting you to approach a GP for your baby to confirm his diagnosis and to get prescription with antibiotics. How does that sound? Like that we can ask. Then mother is somewhat reluctant for going GP, and she is stating that, actually sister, if you know what is wrong with my baby, could you please give me some medications so that it will be easy for me. Actually, I don't want to get GP's appointment because really I'm feeling that is antibiotic in this age, it's not suitable and it is not safe. So I don't want to go to GPs. Like that, mother is stating. So, what is our role? We are telling that resist request for medication because not your role, an examination by doctor needed. Suggest over the counter pain relief if parent doesn't want to see doctor to request antibiotics today. So, how we can state, I am so sorry, Maria. I am not the right person to prescribe any medication to any patient, but no need to worry. If you approach a GP for your baby, of course, he can examine thoroughly and he can find out what is exactly wrong with your baby's ear. And if you don't want to take any antibiotics, I can suggest you some over the counter pain relief. Like paracetamol syrup or ibuprofen syrup for your baby. But I can tell you that this is temporary and your baby may not get complete relief. And I really am sorry to tell you that there will not be any permanent relief with that over the counter medication. This is only symptomatic treatment, but we have to find out exactly what is the cause of your baby's ear. Are you getting my point? Then mother is telling, okay, so you are telling that doctor's appointment is much essential, right? Then we can tell that yes, Maria, of course, it is always better to consult with a doctor before treating baby's self with with self. Then the next one is a reassure parent, like antibiotics safe in small doses, short-term use only, and doctor can provide more informations, etc. And establish parents' consent to make GP's appointment for his or her son. So we can tell that, Maria, I am strongly recommending you that there is nothing to be worried about the antibiotic use for your baby, because I am reassuring you that these antibiotics are safe in small doses and it is a short term use only. Maximum it will be for 7 days. So the doctor can provide you more information regarding this antibiotic use. According to your baby's age, weight, doctor can calculate the dosage and she can prescribe for your baby. Is it clear for you? Then mother is telling that, okay sister, I can understand and I am willing for that. Then we can establish parents consent to make GP's appointment. So how we can present, do you have any other concern, my dear? Then she's telling, no, I don't have any other concern. Then we can tell that, well, I hope I have clarified all your doubts. If you don't have any other clarifications, may I proceed with your baby's GP's appointment? Is it okay for you? Then mother is telling that, okay sister, you can do that. Then we can tell, thank you. I wish speedy recovery for your baby. So that's enough. So by this we can wind up the scenario. So this is an example of the presentation. You can add some more points or you can do as your convenience. But all points should be there and you should not miss any points. And throughout the role play, there should be reassurance because you are talking to a parent. And that also, one small boy is crying and complaining your pain. So throughout the role play, this reassurance should be there. And because this is like a resistance is there, mother don't want to see GP because she doesn't like antibiotics for her baby. So here you have to explain some more details about antibiotic which is safe and according to the height and weight, they will adjust the dose and it is like a short time. And these points, when you are explaining, you have to stress the point because you have to convince mother to have appointment with the GP for her boy. So in this way and in this type of role plays, you could not make it like a compulsion. It should not be like a compulsion. It should be in a polite manner. You can explain the things and at the last matter how to be convinced. So that is the success of your role play. Any role play if you take, you can see that there will be one convincement. So how much you are making the role play politely and from the interlocutor side it is easy for them to agree with your suggestions. So that is the B grade. So even if you success to if you are success to get the convincement, so of course you can get the B score. And of course the grammar, everything have to be pointed. But even though I'm telling some points, the politeness, the way of your talking, and it should not be like a demanding, you should do, you have to do these things and all, you can avoid, and maximum reassurance we have to give. So I hope it is helpful for you, and in the description I can keep the role play card, and if you want to practice with your friends, of course you can make use. So we will see with another one informative video. Until then, bye, take care.